Hi everybody, I'm Rosie Hogg and it's great to be with you on this World Day of Regional Anaesthesia and Pain Medicine. I'd like to talk to you about this excellent point of care ultrasound study from 2024, looking at the accuracy of lung ultrasound score for prediction of major adverse cardiac events in patients undergoing hip fracture surgery. So this is a prospective observation multi-centre study of over 800 patients, looking to see whether a systematic preoperative lung ultrasound score can provide better accuracy for major adverse cardiac events than our traditional grading such as ASA, Revised Cardiac Risk Index, or the NSQIP-MICA. So of note, in inclusion and exclusion, only patients undergoing spinal anaesthesia were included to reduce any confounding from general anaesthesia in postoperative pulmonary complications, and patients were excluded if they had recent cardiac events, acute heart failure, or severe pulmonary disease. So it was a pretty standard 12-point lung ultrasound score looking at 12 different zones and really looking for the presence or absence of B lines in that interstitial lung water. So grading from 0 to 3 in each of these areas. And so the overall score was anything from 0 to 36. What did it find? So in these patients, there was 108 major adverse cardiac events across 98 patients. And what was shown is that the Revised Cardiac Risk Index correlated well with an increased lung ultrasound score in patients who had a major adverse cardiac event. ASA and MICA was not correlated as well between groups of these major cardiac events. So what does this really mean? So it means that lung ultrasound can be used, and particularly this grading and scoring system, to be able to try and predict which patients may suffer an adverse cardiac event. And I think what was really interesting for me for this was that this threshold of 7.5 was identified. So patients who score between 0 to 7 can be classed as negative and are at lower risk of having a major adverse cardiac event. But patients who are positive, 8 to 36, again, are at higher risk. And you may consider sending these patients to maybe critical care or observing them a little bit more closely in the postoperative period. And this showed certainly an increased sensitivity and specificity compared to the other traditional grading methods. For me, what was really interesting is that the negative predictive value was high. So if somebody had a low score, certainly between 0 and 7, you could be a little bit more optimistic that there would be a decreased risk of a postoperative major cardiac event. And you can see this across all of the different gradings, is that there was particularly an increased specificity with the lung ultrasound, and its accuracy was much higher than any of the other traditional grading methods in predicting whether somebody was going to have a postoperative adverse event. Included in this was if a patient has already got chronic heart failure or has renal failure as well, this added in to increase their risk of a postoperative cardiac event. So again, it's not about just using one thing in isolation, it's getting more information for these patients and being able to identify who's at higher risk of a postoperative cardiac event. So in conclusion, can lung ultrasound score predict major adverse cardiac events? It certainly seems to in comparison to our traditional grading methods, and it's something that could be really, really helpful in this. Thank you so much.